My name is Pam Burgum. I am a speech-language pathologist, and for the past 25 years I have been working with hard of hearing adults. I'm hard of hearing and wear a hearing aid myself. I teach speech reading and communication strategies in addition to doing educational presentations on hearing loss throughout the community. Today, my colleague Diane Contreras and I will be talking about hearing loss, how it affects the individual and the people communicating with them. There will also be information about hearing aids and assistive listening devices. Hearing loss is a common problem in modern society. This is due to the combined effects of noise, aging, disease, drugs, and heredity. Hearing is a complex sense involving sensitivity to the ear as well as the ability to understand speech. All people with hearing aids are different. No two are alike. Hearing aids are not like glasses. They help, they do not correct. The benefits an individual has with hearing aids depends on two things: the amount of residual hearing they have and the amount of word recognition or understanding. Residual hearing is the hearing that a person has without their hearing aids on. Word recognition is determined by a test that will tell a person what percentage of 100 words they understand. Everyone has a different percentage. Now we're going to give you an unfair hearing test. You will hear a list of 10 words that will simulate a common high-frequency hearing loss. Write them in a column. Let's begin.
Word number 1, who. Word number 2, who. Word number 3, ma. Word number 4, da. Word number 5, small. Word number 6, miss. Word number 7, test. Word number 8, thumb. Word number 9, dish. Word number 10, spill.
How did you do? I'm sure none of you got 100%. Just think, this is how many of your patients hear all the time with a hearing aid on or not. Let me tell you, 30 million people have hearing loss, but only 1/6 of them have hearing aids. 15 out of 1,000 people under the age of 18 have a hearing loss. 25% of people over the age of 65 have a loss, and 90% of people over the age of 80. Roughly, that means 1 in 10 have a hearing loss. These numbers are increasing every year. Now my colleague will talk to you about types and degrees of hearing loss.
Hello, my name is Diane Contreras and I am an audiologist. Audiologists are healthcare professionals who identify, assess, and manage disorders of the auditory, balance, and other neural systems. I'd like to start by discussing various types and degrees of hearing loss. When an audiologist performs a hearing evaluation, they obtain a graph. This graph displays that individual's specific results, and it's called an audiogram. You can now see an audiogram of familiar sounds. This graph shows the softest levels that an individual can hear various sounds. The audiogram shows frequency and intensity. The following are some examples of different sounds at various frequencies and intensities. There are three different types of hearing loss. The first type is a sensorineural hearing loss. This type of hearing loss occurs in the inner ear, the auditory nerve, or the parts of the brain that receives nerve impulses from the auditory nerve. The second type of hearing loss is called a conductive hearing loss. This type of hearing loss occurs in the outer ear and/or the middle ear. Something prevents the sound waves from reaching the inner ear. The third type of hearing loss is a mixed hearing loss. Mixed hearing loss occurs both in the outer or middle ear and in the inner ear. It's a combination of a conductive and a sensorineural hearing loss. Often you have both a loudness and a clarity component to the hearing loss. Sometimes medical or surgical intervention can help but not correct this type of hearing loss. Next, I'm going to talk to you about the specific degrees of hearing loss. Hearing loss is classified by degree, ranging from the softest level that an individual can hear sounds to the loudest level an individual can hear sounds. Normal hearing ranges from 0 to 20 decibels. A mild hearing loss ranges from 21 to 40 decibels. A moderate hearing loss, 41 to 55. A moderately severe hearing loss from 56 to 70, and a severe hearing loss, 71 to 90 decibels. Any profound hearing loss is 91 decibels and higher.
Hearing loss is often gradual. Others notice it before the person themselves. Many older adults deny hearing loss. Here are some of the signs of hearing loss you may see in your patient. A listless and weary expression. Frequent requests for repetition. Mispronunciation of words. Turning one ear to the speaker. Voice or speech difficulties. Complaining that people mumble or speak unclearly. Failure to respond when questioned or laugh at a joke, or playing a radio or TV too loudly. There are also many emotional reactions to hearing loss. Many people do not make the connection between these feelings and their hearing loss. They are frustration. Frustration comes with the speaker and the listener. The listener is frustrated because they cannot get the information, and a speaker may be frustrated because they have to repeat the information so much. Anxiety and discomfort. Hard of hearing folks who struggle to hear all day may become very tired. Impatient. Communication is a two-way street, and impatience can come on either side. A hard of hearing person many times feel a loss of competence. They think that when they miss things, it has said something about their brain, while it is just really something wrong with their ears. They might have self-pity. Guilt. Many hard of hearing people withdraw. They withdraw from activities because they can't keep up. They may also be in denial. They might say their hearing loss is not bad enough to do anything about it. They might blame others for mumbling. Once this person suspects they have a hearing loss, they should be seen by an audiologist for a hearing evaluation.
Audiologists are healthcare professionals who identify, assess, and manage disorders of auditory, balance, and other neural systems. Audiologists hold a graduate or a doctorate degree and hold professional certification from an accrediting body called ASHA, the American Speech, Language, and Hearing Association, and also hold a state license. When you suspect that an individual has a hearing loss, you can make different referrals to ensure the proper detection and management of that individual's hearing loss. You may refer that individual to their primary care physician, who in turn will refer that individual to an audiologist for testing. A referral may also be made to an ear, nose, and throat physician that would include an otologic evaluation and a hearing evaluation of the patient. You may also refer directly to an audiologist's office that sometimes is in a hospital, a clinic, or a private practice office. Or you may refer them to the Center for the Deaf and Hard of Hearing for full audiologic and speech evaluations. Next, I'd like to talk to you about hearing aids. Hearing aids come in a variety of shapes, sizes, colors, and types. The most common style hearing aid is a behind-the-ear hearing aid. This hearing aid is worn behind the ear and coupled via an ear mold to the patient's ear. This can be used by patients with mild to severe hearing losses. The in-the-ear style hearing aid is another common type of hearing aid. This hearing aid is worn entirely in the bowl of the ear, and part of it goes into the ear canal. This hearing aid has been the most popular type for 20 years. Another type of hearing aid is an in-the-canal hearing aid. This type of hearing aid fits entirely into the external ear canal with slight protrusion into the bowl of the ear. They are limited in power by their size and used mainly by those with mild to moderate degrees of hearing loss. The size of this type of hearing aid makes it more difficult for some elderly patients to use. The next type of hearing aid is completely in the canal hearing aid. This style hearing aid sits deep into the external auditory canal. This type of hearing aid is designed mainly for mild to moderate hearing losses. Now we'll talk a little bit more about some uncommon style hearing aids. The first type is called a contralateral routing of signal hearing aid. Another uncommon style hearing aid is called a bone conduction hearing aid. Another uncommon style of hearing aid is a body aid. This is reserved typically for patients with profound hearing loss. Another uncommon style are eyeglass hearing aids. This is hearing aids that are built into the temple bars of eyeglasses. Now we'll take a look at some specific parts of the hearing aid. First of all, we have the microphone. This is the piece that picks up the acoustic signal from the environment and changes it to an electrical signal. Then the sound travels to the amplifier. This is the internal circuitry of the hearing aid that increases the magnitude of the signal. Next, the sound travels through the receiver that converts the electrical signal to an acoustical signal, sending it into the ear. There are some pieces that are specific to a behind-the-ear hearing aid: the ear hook or elbow, the ear mold, and the tubing, as seen here. Another piece or part of a hearing aid is the volume wheel. On the behind-the-ear hearing aid, the volume wheel rotates up and down, and on the in-the-ear hearing aid, it can also act as an on-off switch. Another component that's contained on hearing aids are what's called an MTO switch. The MTO switch stands for microphone, telephone, and off. What you see here are the battery doors for the behind-the-ear hearing aid, and next the in-the-ear style hearing aid. It's important that hearing aid batteries are changed every 1 to 2 weeks depending on the style hearing aid an individual has. It's often helpful to work over a towel when changing the battery on a table, so if the battery drops, that it doesn't roll. The smaller the hearing aid, the smaller the battery, and the faster that that battery will drain. Some hearing aids have warnings that will let an individual know when the hearing aid battery is about to deplete. Other times, the hearing aid will just stop working. One easy way to test this is hold the hearing aid in your hand and make a fist around the hearing aid. If you hear a whistling sound, then you'll know that the battery is working. Cleaning the hearing aid is also very important. Making sure the hearing aid is free from wax and debris and stays away from moisture or perspiration are very important. It's sometimes very helpful to have a battery tester on hand to ensure that the batteries are functioning. And it's also important to have a brush and a wax loop to clean out the internal components of the hearing aid. Another way to clean the hearing aid is use a soft cloth to wipe off the external part of the hearing aid. We have all heard at times a high-pitched whistling sound coming from a hearing aid. This is called feedback. In some instances, feedback is normal. For example, as I mentioned earlier, when the hearing aid is cupped in your hand, that is a time when the hearing aid should be normally whistling. Or if you place your hand up next to the hearing aid, that's another time when the hearing aid will whistle. If feedback occurs while the individual is wearing the hearing aid and there is nothing that you can tell that's instigating that feedback, it's important to check the seating of the hearing aid in the ear. It may be loose and this would cause the hearing aid to whistle. So check the seating and push the hearing aid in. Another thing to do is check the volume for the correct setting of the hearing aid. If it's set too loud, it also may be whistling. Another cause of this feedback is if there's excessive wax or debris in the ear canal. So have someone look in the ear canal to make sure there's not too much wax present. And of course, make sure that there isn't an object that's too close to the hearing aid that's producing the feedback. Next, we're going to take a look at the insertion and removal of hearing aids. For inserting a behind-the-ear style hearing aid, pull up and back on the earlobe with one hand and hold the ear mold of the hearing aid between your index finger and thumb. Insert the canal portion of the ear mold first, then seat the top of the ear mold by pushing it in 1 or 2 places. Hook the hearing aid itself up and over the top of the ear. When inserting an in-the-ear hearing aid, pull up and back on the earlobe with your hand, grip the hearing aid with your thumb and your forefinger, insert the canal portion first, and then seat the body of the hearing aid by pushing it in with your thumb in 1 or 2 places. Another device you may encounter is called a cochlear implant. Cochlear implants are surgically implanted electronic devices designed to provide enhanced sound detection for individuals with severe to profound hearing loss who often cannot obtain adequate benefit from hearing aids.
Communication is a two-way street, and it is up to both the speaker and the listener to cooperate. In a caregiving situation, it is important that that caregiver understand these strategies. Before beginning to talk to any hard of hearing person, get the attention of that person. This can be done in a number of ways. You can tap them on the shoulder, say their name. If a person uses glasses, hearing aids, or assistive devices, make sure they have them on. Be sure to face the person in a good light. Speak up, but do not shout. Many times I have seen people shouting into hearing aids of hard of hearing people. Speak slowly and clearly. I've been asked many times, how can you speak more clearly? I tell people, there's a beginning and an end to each word. Use both. For example, someone's not brushing their hair. They are brushing their hair. Identify the topic before you begin speaking. An example of this could be, you come into the room and say to a patient, my mouth hurts so bad, I had 4 root canals today. The patient goes, huh? Better to identify the topic. At the dentist today, I had 4 root canals and my mouth hurts badly. That leads to some sort of association. Rephrase rather than repeat a misunderstood sentence or words. It's very important to eliminate, turn down, or move away from background noise. A television is the most obvious form of background noise, but there can be air conditioners, small heating units, medical equipment that could interfere with communication. Do not eat, smoke, chew gum, or obstruct your face when talking to the hard of hearing. It's good, too, if the person looks like they are not understanding what you're saying, that you ask them what can be done to make communication easier. Don't be afraid to write, nor use body gestures. Ask questions to verify understanding. Stay away from yes/no questions like, is your niece coming tonight at 8 to visit? Versus, what time is your niece coming? This makes the client tell you the time in a verifying form. Cooperate if the person requests clarification. Sometimes that becomes difficult when you're working and in a hurry and have been asked for the 3rd time to repeat. When people are ill or tired, shorten your conversation. Listening is a hard job when you're hard of hearing. It's very tiring. If you're sick or uncomfortable, your concentration will be elsewhere. Get closer to the person and give them some time to respond. If you remember that unfair hearing test, if you're hearing things that sound a little bit mumbly, you're going to need a little extra time to figure out what that word means. It is very important to alter the environment to benefit a hard of hearing person. For example, if you're pushing a person down the hall in a wheelchair and you need to ask them a question, stop the wheelchair, stand in front of them, and ask them the question. When you're talking to a patient in a bed, do not sit next to them. Make sure they can see your face clearly, and perhaps a chair next to the bed is more appropriate. A patient may come into your setting who is a member of the deaf community. In the deaf community, sign language is their mode of communication. In these cases, some of the strategies I will mention now will be most helpful. If the person uses sign language, make sure you have a qualified sign language interpreter present. It might be helpful also to have a dry erase board or a paper and pen next to the person's bed to write them a message. Again, maintain eye contact, using gestures and body language. It is also very important to get the person's attention before you start talking to them. It's helpful to include visual information, for example, pictures and outlines. Make sure there is a good light, speak naturally, and do not exaggerate your mouth movements. Another strategy with the deaf and the hard of hearing could be real-time captioning. This is a meeting of a support group for hard of hearing people. The court reporter you see in the foreground is typing every word said onto a screen for good communication. Diane will now continue with various assistive listening devices to enhance the quality of life of individuals with hearing loss.
Assistive listening devices are designed to specifically help people hear better in a variety of difficult listening situations. Assistive listening devices can also include various vibratory or visual alerting systems. Hospital kits are used to decrease frustration by an individual with a hearing loss while they're hospitalized. They include dry erase boards and different communication tip cards for the employees that are working with that patient. The following assistive listening devices can be used alone or with a personal hearing aid to overcome the negative effects of background noise, distance, and reverberation. These devices give the listener an improved signal-to-noise ratio, meaning that the intended signal, often speech, is heard over the undesirable signal, which is often noise. The first device I'm going to talk about is called the Pocket Talker. This is a personal amplifier that can be used for one-on-one communication or TV listening. Next, an FM system. An FM system consists of two components that transmit sound to each other via radio waves. The speaker wears a transmitter and a microphone, and the listener wears a receiver that picks up the radio waves from the transmitter. The FM systems are often used for large group meetings or situations where the speaker is at a great distance from the listener. Infrared systems are systems that transmit sound by invisible light beams. The receiver must be within direct light of the transmitter to pick up the signal. These are great for TV listening or small group meetings. Next, I'm going to talk about some telecommunication equipment. First of all, cordless amplified telephones increase the ease of communicating for an individual with a hearing loss on the telephones. Cordless telephones allow the individual to move freely and bring the phone with them to various rooms in their home. A corded amplified telephone is seen here. Both corded and cordless telephones have various levels of amplification available and adjustable tone and volume controls to facilitate listening. Another telecommunication device is a voice carryover telephone. The voice carryover telephone allows individuals who are hard of hearing to speak to another person and read the incoming message on the screen. A TTY, or a text telephone, is a telecommunication device used by individuals who are deaf and cannot hear on the phone to communicate with another party. Both individuals must have special text telephones to communicate with each other via visual text message, or one individual can use what's called a relay operator who will relay the message from one text phone to a user who's using a traditional telephone. Another type of telecommunication device is a text telephone. Text telephones allow individuals who are deaf and cannot hear on the phone to communicate with another party with the use of a visual display. Other assistive listening devices are classified as signaling and alerting devices. These devices were developed to alert individuals through flashing lights or vibrations to the presence of emergency signals such as smoke or fire alarms, crying babies, telephone rings, doorbells, and alarm clocks. Closed captioning allows individuals that are hard of hearing or deaf to watch television while seeing what's being spoken displayed across the bottom of the screen in text. It's also very important that you protect your hearing. Avoid loud rock concerts, clubs, and loud activities, or limit time spent there. Always wear hearing protection devices such as earplugs or earmuffs in noisy environments. Keep the volume turned down when listening to your Walkman, your stereo, radio, or television. It's important to protect hearing because it is precious.